I'm Dr. Moser. Well, a few months ago, Pam Goldberg sent an email and asked if I would do a talk. And it was basically something, can you talk to a women's group about spine issues? All right, what do I talk about? There's lots of things there. So I went on to Amazon. I remember seeing this book show up in my little thing I may be interested in. They do that on Amazon. If you look at something, they'll bring up other books you may be interested in. I remember seeing this one. I thought it was a catchy little phrase. And it's High Heels to Hormones by Christina, I think it's Lash. So I went and got that book and kind of went through it a little bit to see if I could see what she talks about and emulate some of her topics. And I thought I'd pass it around in case anybody wanted to look at it. It's very simple. You know, if someone buys it, it's one day's reading, and then you pass it around a little bit. So I went and took a picture of this, and it's a pretty interesting book. It's passed around. The lady is very fond of dogs, but the illustrations all have a cat in it. So I think there's one on top of her head there. I don't see it too well from this angle. And she goes and explains a few things. Now, what are some of the things that commonly cause back pain? Well, the answer is lots of stuff. In general, there are mechanical problems with the spine. Now, I'll list a few other these things, but over one's lifetime, these things can add up. Several injuries, if you're constantly injuring your back, hurting a disc, it eventually starts wearing out. Little injuries to the joints of the spine, they start getting more and more arthritis. Then you got acquired things. These are conditions that one gets, whether it's rheumatoid arthritis, osteoporosis. These things add to the problems with the spine. Also, the spine, like everything else, is living tissue. It's not just a Legos erector set that we have in our bodies to hold everything up. The spine is a living organ itself. The disc, have cells in it, they grow. They're not just static things. So different medical problems will affect the disc like other parts of the body. Diabetes, smoking, they can cause heart attacks and strokes. Well, they also increase the wear and tear changes on the spine. In general, there are several sections of the spine that we talk about: cervical, thoracic, and lumbar, although this picture doesn't mention the area where the spine connects to the hips, the SI joints or sacroiliac joints. The cervical spine, well, this is a thing to women. So are there any differences between men and women as far as the spine and such? Well, you are designed differently. The joints of the spine tend to be a little smaller. The cartilage that's in between the joints, the areas that rub and move and allow the motion, darn it, that's a little thinner too. Your hormones over your lifetime do affect how the cartilage and collagen fibers that make up all this wear out, or how they function over time. Also, you women make this interesting little hormone called relaxin, and that's what it does. It causes the ligaments or the collagen fibers that make up the ligaments and tendons to relax and become more stretchy. You get huge amounts of this when you're pregnant and getting ready to have a baby, because your body has to get the baby out, and the joints of the spine, the hips and the SI joints all got to move more than they normally would. But in small amounts, this hormone may be released and can cause the joints of the spine to be a little bit more flexible. And when that happens, they can get a little bit more injured or hurt more. Many and some studies have shown that around the menstrual periods, there's more back pain. Some of that just isn't the menstrual period, it's what's happening in the rest of the body due to some of these hormones. Some of the mechanical problems. Oh, I was at a sports event with my kids the other weekend, and there's one lady who obviously has seen the plastic surgeon, and she was running around constantly complaining that her back hurts. And yes, that was probably the reason. The center of gravity that we have, if everything is perfectly centered on the spine, it holds up better. If you put weight forward, well, guess what? The muscles have to work harder to pull things back. Well, women are designed differently. Sometimes the weight is pushed forward, but also you carry weight a little bit lower. Okay. And there's the cat hit by the watermelon at the bottom. All right. The thoracic spine. The thoracic spine, from the neck to the lower area, well, not much happens there, but you do see scoliosis or curvature of the spine. Women are more susceptible to this than men, but it happens as you grow. And guess what? This abnormal curvature is putting stress on the joints of the spine, and that's going to hurt eventually. Osteoporosis and fractures. Well, you may have heard about the big fractures where the bones of the spine crack and collapse down. And there's things we try to do to treat that problem. But even when you have just mild loss of the calcium in the spine, there can be little microfractures, little bits of edema in the bones itself. As I said, they're living parts of the body. So as it gets weaker and the discs are not cushioning as much as they used to, these bones are getting little injuries to it, and they can hurt. There it is again. Slouchers. These are things I've stolen from this lady's book here. Yeah, the posture. Your women are pulled forward, so sometimes you're slouching. And this isn't very healthy for the spine because you're putting stress on areas that normally work better if you're sitting up straight. The lower spine. Oh. If you notice, she's in front of a computer all day long. She's sitting, and it turns out this position puts greater stress and pressure on the discs themselves. Somebody somewhere volunteered for a study where they put pressure monitors in the disc, and they measured in different positions. It turns out sitting down, especially bending forward, the pressure jumps up greatly. We're designed to distribute that weight better when we're standing up straight and our shoulders back. How do we evaluate the spine and problems of it? Well, first off, we may get x-rays, but understanding x-rays is just a static image. All we see are the bones. We can see the alignment of the bones, and if there's a fracture, sometimes we can see that. But they are limited in what they tell us. All right, CAT scans. Well, that's a fancy x-ray. Always kind of, when I mention CAT scans, I always think of the Beatles. Apparently, the gentleman who was their sound engineer came up with the algorithm of how to do CAT scans. So thanks to the Beatles, we have this technology. It's an interesting story. But it just shows us the bone. It shows us a little bit of disc, but it shows us the bone and what's going on. Another test, if we order it for back problems, is a bone scan, or we may use the term SPECT scan. What is that? Well, unlike the other studies, it's showing us activity. This study, we give someone an injection of a radioactive iodine tracer type thing, not iodine, but tracer. And wherever it goes is wherever there's activity in the bone. If you have a small stress fracture, it shows up as a black dot. We go, there we go. If we find a fracture in the pelvis, it may show us that. They're not easy to see on x-rays. Okay. The MRI, which is a giant magnet, which has really no radiation or problems with it. It's a very safe test to do and gives us extremely clear images of the spine. It lets us see what's happening with the disc. And as I mentioned earlier about osteoporosis and little fractures and edema, swelling in the vertebral bodies, we can often see that on this scan. It's that good. These EMG nerve conduction, these are nerve tests. Now this is different. All we're doing is looking at the function of the nerves. If a nerve is injured, and it has to be injured, we may pick up abnormalities with it, and that tells us some information, such as which nerve is hurting. So if it's the number 4 nerve and we find things, well, we know it's the number 4. Sometimes this is very necessary because people have a lot of bad things going in their backs going on, and we're trying to figure out which place is causing the problems. Another thing we do to evaluate the spine is a diagnostic injection. Well, what's that? Well, if we think this joint here hurts, let's say it's the SI joint. You know, a lot of stuff happens in your hip and bottom side here. We're trying to figure out which structure there is causing the pain. Let's say if I inject this SI joint where the spine connects to the hips and the legs, and that relieves the pain, well, that tells me that's the spot. So sometimes this stuff is very helpful to determine what exactly is hurting, because some people have, you know, lots of wear and tear over years, and we're trying to figure out which spot is the spot that's causing the problem. All right. So we know the areas of the back that can hurt and how women are somehow different in some ways. Those are the tests that we can order. When we get that, well, how do we treat back pain? Well, I tell people we treat it with a plan. Our options to treat it are physical therapy or physical medicine, whether a chiropractor or a physical therapist does it. What they do is that the body is meant to work a certain way, and a physical therapist can help you do that. We have medical therapy, that's medicines and such. As I mentioned, some injections, and the last thing would be a surgical opinion. I'll talk a little more. Physical medicine. I remember my Aunt Rose, who's 70, no, probably 80 some years old now. She would go and take us or my nieces or stuff, and she would straighten them up. So she would always say, straighten up. She would get you in that proper position if they're slouching. You know, she was right. That does help. And she's in her 80s, and she sits up straight. There are other things that you can do with your body, and that's, of course, yoga and working in a gym. We're meant to be active, and it's important to be active. If the muscles in your spine are weak, they're not supporting each other, and that puts more stress and work for the disc and joints. So physical medicine is very important for your spine. You have to be somehow physically active. We know people who are, if they have back pain, they lay in the bed, they hurt more. Pills, potions, and patches. In general, the medications we use fall into several categories, whether they're some type of anti-inflammatory or specifically a steroid. We know when there's an injury, just like smashing your finger or hitting in the door or something, it swells, it's red, and it hurts. So that's inflammation. So an anti-inflammatory can help that. Steroids are a little bit stronger. We have this other group of things. These are pain modulating medications. And the story behind that is that we were using medicines like gabapentin or Neurontin for seizures, and people kept coming back saying, my back pain's better, or my shingles pain is better. And we found out that some of these medications, not only do they treat seizures or other disorders, that they can help pain. So they're very helpful in some people. And then we have narcotics. Now, everybody's first idea is that, I don't want to take any of these pills. These are strong medications. Well, you know, there's a reason why they help with pain, is because the receptors in your brain have a little, we call it a receptor, there's a little device that they connect to, and they tell that cell to be less painful. So they're there for a reason. We make in our cells these little hormones or chemicals that treat pain itself. And all we're doing is coming up with medicines that look like something our bodies naturally have, and we're giving it to them to have that effect. People are always wondering, am I going to become addicted to a narcotic? And I tell them that there are two things. One, you can become psychologically addicted to anything, whether it's collecting little plates or any books or shoes. You can become addicted to doing lots of things. But will you become physically where your body craves it? Well, you know, people who have diabetes, or you can say they're addicted to insulin, they have to have it to control that problem, but they're not acting like someone who is addicted who will go out and steal and take things. So your body needs it sometimes. Okay. Injection therapy. All right. Epidural steroid injections. Let me explain what that is. Epidural refers to a location, and that's a covering around your spine and brain. It's a tough ligamentous tissue. And like when you ladies are having your children, an epidural, well, the anesthesiologist just goes in and puts some numbing medicine there to limit the amount of pain you're feeling. Well, what we do is we put steroids in there. As I mentioned before, steroids are very powerful anti-inflammatory medications. And when a disc or a joint or something is hurting, it's inflamed. It physically looks red, irritated, and swollen. So when we inject a steroid into that area, we're treating the inflammation. Now you may have heard someone say, well, that epidural didn't work. Well, more than likely, it just wasn't something that was inflamed. It wasn't really all that swollen and red, so the steroid didn't have that much to do. The next thing I've listed is facet joints. Now what is this? Well, especially in like skinny little children, you can see every vertebrae or bone in your spine has a little joint, and it locks in to keep everything from falling over. These joints allow us to have movement. Well, just like our fingers, if we're constantly doing something, well, they can get arthritic. They can hurt, and they themselves can become the source of pain. If I can inject a little drop of a steroid in that joint and decrease the inflammation, once again, the pain may go away. This thing we call a medial branch block is just a diagnostic block. I go in and I put a drop of numbing medicine on that little joint of the spine, and if the pain goes away, well, that's where the pain's coming from. Sometimes I do these injections, they get up and they say they still hurt. All right, the pain's coming from something else. It's not that little joint that I was injecting. I also tell people that epidurals and these injections, they don't fix anything. What I mean by that is that those two, they don't make that disc go back into place. They don't make that painful joint, the arthritis, go back to normal. We're just treating the pain. The body has to heal itself up. Now, some other treatments you may hear about are called radiofrequency. It's vibration, just kind of like a microwave. We put a special little probe right up close to the structure we're trying to treat, and it vibrates. Well, there's two types or levels of vibration. There's something called pulsed and thermal. Well, it's probably better to say stun or kill. That sounds scary. Pulsed, the vibration doesn't heat up enough to cause any tissue injury. And it's a little bit of a mystery, but it does seem to reduce the amount of pain a nerve generates without causing any damage. But the thermal, yeah, that gets hot. And it will burn that little twigs of the nerves. That's what we're after, a twig of a nerve going to a joint that's hurting. And if I can zap that little twig, the amount of pain may go down. You never get all of it, but you can make the pain a lot less. And sometimes you don't need to take pills. Okay. So that's a treatment we may do for different types of arthritis or nerve pain. Today, I was looking at some of the websites. I think it was CNN. And Jerry Lewis, this is going to be his last muscular dystrophy telethon. He's like 85. He tells a story, and I was at a meeting where he was at, and he told his story. He fell one day on the stage, and a little screw or nail that was left there hit him right in the back. Ever since then, he's He's hurting. He's got chronic pain. And as he talks, he said that he got on narcotic pain medications and hated it. He felt that for him, it took the joy of life out of him. And he was, and this is kind of sad, he was close to committing suicide. He was contemplating that until one of the doctors tried the new technology called a spinal cord stimulator. All that is a little device with a little mild, small electrical current. And you put that in that epidural space I talked about, and you turn it on, and you feel a little tingly sensation. Sometimes down your back, down your legs. It may cover different areas depending on where we put it. But it's another way of treating pain. When we do these, we put them in temporarily, maybe a week. And we let you see what it's like. Does it control the pain? Does it feel better? Does it reduce? You know, and it's another way of treating people with chronic pain. Okay. It can be permanently put in if you think it worked. So just repeat that. We put it in temporarily to see if it works. If it doesn't work, we take it out. But like Jerry Lewis, it's incredible. At the conference, he was up there moving around, talking. He turned it on, you know, and he couldn't do that if he didn't have this device. All right. Last thing I put up there is other. Oh, other. What is that? I usually call that voodoo medicine. There are some things out there which we don't have good research on. Some of these things are like prolotherapy or plasma-rich injections or platelet-rich plasma injections, I think it is. Well, some people have an injured joint, and that joint isn't healing up. It's continuing to hurt. In some cases, we may inject someone's own plasma. We take it out of their vein, spin it down, get rid of those red cells, and inject it back into that joint. And it may promote healing. The little cells that make these fibers for the ligaments and tendons may start to grow and thicken and become strong again. We just don't have good research on it. That's why I kind of call it voodoo therapy. Willing to try it sometimes, but there's always something else. Surgery. Anything from very minor things to major surgery. Of course, a surgeon's best to tell you what is offered. If Dr. Neve or Dr. Freund or Dr. Cohen, if you see one of them for back pain, they'll go over and say, this is what we can do. Sometimes that's a fusion where they take the disc out and put metal rods in and screws and stuff. Other times it may just go in there and take a little piece of that disc that's protruding and hitting the nerve and clip it off. They have lots of things. There are some very minor surgeries that they can do, all the way to the big ones. But the surgeon's best to explain if that's helpful. Okay, all done.